Hello there. Welcome to episode 271 of Healing Outside the Box. My name is Jean Tiberio, and I'm a nutritionist and a wellness coach. Now, before I begin, a little disclaimer. This podcast is for educational purposes only and must not replace advice from your own healthcare provider. Always consult your own doctor before taking any medication or supplements. Having said that, I also want to say that you may have stumbled upon this episode because of the title I used, associating a deficiency of vitamin D with severe COVID-19 symptoms. I have to say that vitamin D is not a cure, but there is also no downside to having enough vitamin D. Vitamin D is important for proper immune function in addition to building strong bones and teeth. Also, FYI, the experts say that we shouldn't rely on outside exposure for our vitamin D, especially true for our elders, overweight folks, and dark-skinned people. Now, in my last episode, I mentioned that vitamin D binds to the same binding site on the border or cell wall of our cells as COVID does. I mentioned that vitamin D may act like a decoy, crowding out the virus and hopefully keeping it from attaching into that lock and key position, allowing it to enter the cell. Once inside the cell, it eats our nutrients, replicates, and kills off the cell. I promised to look into it further, and when I did, I was surprised at the huge number of recent research articles on the subject. I started taking notes as I was going through the articles on what I thought was the important point they were making, and I am now up to 12 typed pages of notes. So I'll just go through the different journal articles in no particular order. I will put a link in the show notes for all the articles I'm discussing. And of course, there will be hundreds more journal articles I expect over the next year or two. First, there is a talking head YouTube video where two physicians were discussing vitamin D deficiency and COVID symptoms. One of them, who has seen over 1,000 COVID patients, is recommending vitamin D to all of his patients. He mentions that the science has not caught up to what the physicians in the field are doing, but so many of his severely ill COVID patients were deficient in vitamin D, and since vitamin D is a necessary vitamin in the production of T cells, it would certainly do no harm to make sure that they are sufficient in vitamin D. According to some scientists, that would be about 50 nanograms per mil in the bloodstream. But that's only an estimate, since the need is different in different individuals. Related to that, they also mentioned that very overweight people need more vitamin D than others. Presumably, he said, because fat cells or adipose cells tend to store but not use vitamin D. So the vitamin gets tied up and is not available. The next journal article was a very short abstract, but I'm going to quote the title. Quote, Vitamin D supplementation, an alternative to enhance the effectiveness of vaccines against SARS-CoV-2? Close quote. This title comes from the Journal of Vaccines. Again, it's just an abstract, but it cites a bunch of similar journal articles. They end the title with a question mark, which is unusual for journal articles to do this. I wonder if they are trying to draw attention to their research because of the emergent need to distribute the information. In other words, they all know that double-blind placebo studies take years. They have to start with laboratory mice or rats and get through all those. But we don't seemingly have years if we want to save people from serious illness or death this year. In the next journal article, they basically looked at studies from the past, which they sometimes call retrospective cohort studies. Let me stop and define retrospective cohort study. These are studies where they examined the medical records from large numbers of patients who have one similar outcome, in this case, serious COVID-19 symptoms, and they determined that there was a correlation between patients with severe COVID-19 symptoms and those with low levels of circulating vitamin D. Then they mentioned something interesting. The appearance of new mutations means that we can expect more mutations, and that means that we will need to increase the effectiveness of vaccines with a complementary alternative boost. So they have been thinking for months that a boost will be necessary. Generally, in abstracts, they start by talking about evidence of something that suggests the need for the testing that they are about to do. What they said here is that in the past, with the influenza virus and common cold viruses, additional therapies done at the same time improve the outcome. I know there's been a lot of talk around the water cooler or the kitchen table, like, first they tell us we only need 2 vaccines, and it will be 95% effective. Then they tell us we need 3 vaccines, and it's not 100%. What's up with the scientists? Well, I can't speak for all scientists, but generally speaking, they don't stand in front of a microphone and go blah 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 unless they can prove it. They are unlike politicians in that regard. So here is their quote on the subject of vitamin D and severity of COVID symptoms. Quote, "Therefore, the present review proposes the use of vitamin D as adjuvant micronutrient to increase the efficacy of vaccines against SARS coronavirus 2 infection." End quote. That's pretty definitive, in my opinion. But not every journal article is saying the exact same thing. The British Medical Journal, published in May 2021, wrote that there are no relevant randomized control trials proving an inverse relationship between vitamin D and severity of symptoms or mortality due to COVID-19. I'll put a link to that as well. But I personally made a note of the fact that it was published relatively earlier, May 2021, and worded to say no relevant randomized controlled trials that proved it. Again, my opinion, but what this says to me is that though the relationship seems to be looking like a duck and quacking like a duck, we need the science community to duck. So cautionary would be the word here. It could be a goose. There was another retrospective case control study more recently in an Arab Gulf country that said this in their title, quote, "Severe vitamin D deficiency is not related to SARS coronavirus 2 infection, but may increase mortality risk in hospitalized patients." Now, some of these journal articles in PubMed under NIH don't provide the abstract for the research and the details unless you pay them, which is a bummer. But if I'm not mistaken, it seems the authors of these journal articles are now uploading the conclusion right in the title. Again, this is unusual. It's telling me that even the researchers think we need to speed this up. Here's an interesting one. Quote, "Conclusion, in hospital settings, 25-hydroxy D3 deficiency is not associated with SARS coronavirus 2 infection, but may increase risk for mortality in severely deficient cases. Clinical trials are warranted to determine whether vitamin D status correction provides protective effects against worse COVID-19 outcomes. Close quote. What this is saying is that in other situations, clinical trials on animals would be ideal. But who is going to make a patient vitamin D deficient knowing that it could set them up for serious COVID or even death? That is just not going to happen. This next NIH article gets more into the reason for some of this relationship. Now, I know I'm repeating myself, but for some background, coronavirus disease 2019, or COVID-19, is caused by severe acute respiratory syndrome coronavirus 2, meaning that there was a SARS-1. In this SARS-2 disproportionately targets older people, particularly men, and I have my theories about that. Well, I won't keep you in suspense. It's because men are more susceptible to high blood pressure. Also, ethnic minorities and individuals with underlying diseases such as a compromised immune system, cardiovascular disease, hypertension, as I've mentioned, and diabetes. Now, here comes another article. Quote, vitamin D deficiency can cause an overactivation of the pulmonary, meaning lung, renin-angiotensin system, or RAS, leading to the respiratory syndrome. Again, that's an enzyme, makes a reaction happen. RAS is regulated, in part at least, by angiotensin converting enzyme 2, or ACE2, which also acts as a primary receptor for SARS coronavirus 2 entry into the cells. End quote. So what is this renin-angiotensin system? Well, this system, sometimes called the renin-angiotensin-aldosterone system, is a fancy way of saying that the kidneys and lungs are controlling our blood pressure with a complicated system involving hormones. Renin comes from the kidneys, angiotensin precursor comes from the liver, and the angiotensin converting enzyme comes from the lungs. Now I'll repeat what I just said regarding this article. Vitamin D deficiency can cause overactivation of the pulmonary renin-angiotensin system, leading to respiratory syndrome. So overactivation of this system then makes too much aldosterone. Aldosterone is a substance that increases our blood pressure. There's the connection. It's like it's squeezing your blood vessels, potentially causing vascular damage, i.e. heart attacks or strokes, or cognitive impairment, leading dementia. This is a long way of saying the researchers have already made this connection. Another larger article also talks about this decoy theory. Vitamin D attaches to the same sites as the COVID-19 virus and therefore gives the virus some competition to getting into the cell. They also note that vitamin D deficiency is more common in Black and brown people, as well as the elderly. There's one more study that I want to bring to your attention. It suggests to me that scientists know where they are going with all this, and that is to make a pill to do what vitamin D is doing. So this last article I am bringing up suggests that they are starting to test various drugs. This is only one of many studies looking for drugs to take that would do something similar to vitamin D. They are testing a drug that can possibly block the attachment of COVID-19 virus to the cell through this receptor. but it's the same receptor that attaches vitamin D, as I've mentioned. Here's a quote from the article. Quote, testing the efficacy and safety of Bio 101 for the prevention of respiratory deterioration in patients with COVID-19 pneumonia, a structured summary of a study protocol for a randomized controlled trial, end quote. Here is another quote. Quote, the angiotensin converting enzyme 2, ACE2, serves as a receptor for the virus, COVID-19. Interaction between ACE2 and COVID-19 spike protein seems to alter the function of ACE2, a key player in the renin-angiotensin system, or RAS. The clinical picture of COVID-19 includes acute respiratory distress syndrome, cardiomyopathy, multi-organ dysfunction, and shock, all of which might result from an imbalance of the renin-angiotensin system, or RAS. This is only one of many articles testing a drug that can possibly block the attachment of COVID-19 to the cell through this receptor. But it is all the same receptor that attaches vitamin D. In summary, I bet you're relieved to hear that. Quote, multiple observational studies have shown that serum concentrations of 25-hydroxy D3 are inversely correlated with the incidence or severity of COVID-19, end quote. Now, I'm no longer quoting. This is just me. I think we all know what we can do here. We can have our vitamin D levels tested and supplement with the best quality vitamin D that we can afford. And it's not that expensive because it's a vitamin. Because, quite frankly, there is no downside to that. And we can do that now. And since Big Pharma can't sell sunshine, that's relief. We can make sure that we are all eating quality whole foods, especially in winter, with lots of fresh fruits and vegetables for those antioxidants, which always help, and less processed, salty foods. And a good quality vitamin D supplement can now be the cherry on the cake, or fruit salad in this case. That's all I have for you today. Be well and stay tuned next week for another episode of Healing Outside the Box.